Oregon working to figure out how patients will be affected by Medicaid cuts. Welcome to Queen 6 News at 5. I'm Elizabeth Dinh.
I'm Jeff Gianola. Almost 1.5 million Oregonians are enrolled in the Oregon Health Plan, the state's Medicaid program. And Oregon Congresswoman Bynum in Oregon City today to talk about what's ahead and its effects on folks. Lisa Balick joins us live with more. What did the Congresswoman have to say, Lisa?
Well, she's fighting to try and restore the cuts, but keep in mind that Medicaid pays for low-income folks to have health care. 1 out of every 3 Oregonians depends on it, and more than 50% of Oregon kids rely on it. But right now, the question is whether it's going to be around, whether some of these folks are going to be pulled out of that system.
I'm also concerned about the loss of access and supportive care that our patients will face if we are forced to cut services due to financial constraints.
Dr. Bender practices at the Neighborhood Health Center in Oregon City. She's among healthcare providers and patients concerned that small health centers like these will cut back services, cut the number of patients, or completely disappear. They rely heavily on state and federal funding to help pay the bills of tens of thousands of patients on Medicaid. Congresswoman Bynum saying today she's concerned about Medicaid cuts and the extra paperwork that will have to be done. The added requirements by Republican members of Congress designed to make sure those who get the assistance actually qualify. There'll also be work requirements for Medicaid enrollees. I spoke with a mom who gets her health care through the Neighborhood Health Center. She tells me they helped her out when others didn't.
Everyone's going through something, and we need to be able to lean on our community and our providers, and without having that, coverage, we're going to see a lot of people suffering.
I asked the Congresswoman, what's the plan now to try and get back some of the Medicaid funding, especially when Democrats are in the minority party?
The way I think of it is like civil rights. We had a long track record of very poor civil rights in this country, but you continue to apply the pressure, you continue to elevate the issue, and you continue to show the harm that it is doing to our country.
Now, keep in mind, if you are on the Oregon Health Plan, that is not disappearing. Nothing is changing right now. These are questions to be figured out down the road in the next few months as to what's going to happen. A lot of pressure on the state of Oregon to try and figure out whether the state can come up with more money to backfill some of this. We'll be following all this very closely. Live in downtown Portland, Lisa Balick, Queen 6 News.
Thank you, Lisa.